Since 1990, IHR has been at the forefront of innovation, shaping exciting and more effective programs. Hello, I'm Dr. Norma Finkelstein, the Executive Director of the Institute for Health and Recovery. We were founded in 1989 as a service, research, policy, program development, and training organization. Our programs include prevention, early identification, intervention, and treatment services that can be life-changing for our broad spectrum of clients. Today, I want to introduce you to 4 of our projects and let our clients speak for themselves.
Of course, no one plans on becoming homeless, needing to flee a violent relationship, or using drugs and alcohol. So when that person or family needs help, they don't need to be judged or shamed, and they certainly should not have to jump through hoops to get the help that they need. IHR's outreach and engagement model uses a home visiting, community-based approach, integrating clinical care coordination and brief counseling that focuses on building relationships with at-risk and hard-to-reach families, individuals, and youths. It even includes occasionally meeting on a park bench or in a coffee shop, whatever's convenient and safe.
I was lost a little bit. I didn't know a lot of things, a lot of places, like resources that were available to me until, I got hooked up with Project Rise.
Struggling a lot actually. Had to get myself together. She came to help and talked to me a lot, and I got myself back on track.
Before I started working with Project Rise, I didn't receive any help.
So now we're working it out together.
The way Project Rise was different was Suzanne was down to earth, almost I could relate to her. She didn't look down on us. You probably think that it's something that you wouldn't want someone to talk to you or know your family, your business, but it's not like that at all. It's more like a friendship.
And we can call her at any time we need help for anything. She's still right there, so she's close to our family, which is good.
I probably would have still been smoking marijuana.
Going on the wrong street, actually.
I definitely would have lost housing.
Still would have been struggling.
We definitely went a whole different route.
Yes, definitely. Going through Project Rise, they'll probably get themselves together quicker than they would if they just try to do it alone. Definitely would.
We've actually bettered our lives, actually. I'm happy. I'm moving.
That's wonderful.
Nurturing oneself is the first step towards nurturing others. The Nurturing Program for Families in Substance Abuse Treatment and Recovery is a program designed for parents who've been affected by substance use disorders, mental health issues, and trauma. The parenting team provides cross-training to other health and human services systems working with families to build awareness of substance use disorders.
This is our sisterhood in here, us girls getting together and trying to help each other. We're trying to change our lives, and then you're coming and teaching us how to change it. It's extremely hard to be trying to get sober and stay sober daily and then take care of 2 kids. I just wasn't there for my son. He'd come home from school. During school I'd be getting high. After school I'd give him something to eat and I'd put him to bed so that I wouldn't really have to not deal with him, but I wouldn't have to have him around because I wanted to get high instead of take care of my son. I loved the group, it was a good group for me. I learned a lot, and we did a lot of different things that we don't do normally. It made me look at how I'm raising my kids right now. You really were there for our needs, because we did bring up a lot of things from the past, and not a lot of us went through good things in the past, and so it was good to have someone that didn't know anything about us, can't look at our files or anything, and come in and just put on your program and help all of us. I know that you were never judgmental either. Never ever judgmental. It's not like some people look at us, addicts, alcoholics, as different, but you looked at us like, we're just trying to do everything that we can for that day and trying to get better. So it was good. It was.
At IHR, our work is focused on the most vulnerable populations. Each potential participant and family member is approached in a manner consistent with his or her cultural identity, values, circumstances, needs, and age, especially as it pertains to children and youth. Here at IHR, we get it. We understand that when kids, adults, families are at a tough place, sometimes feeling paralyzed, what they need is for someone to help them get back on track, a system to help.
It wasn't my mom, it wasn't my family, it wasn't the problems, it was the drugs. My life was really going downhill. I was on a path to self-destruction. Doing drugs, smoking, marijuana really didn't help my cause. I was yelling at my mom a lot. We never communicated. It was always yelling. It was always arguing. Marzi's really just made things better. She's very supportive. She gives me kind of like a boost of confidence, and it helps me through the day. And she'd be the one to like get me back in line. She kind of lets me set my own goals. Really, we came up with a plan that really helped.
Are you still using anything?
No. I don't know, I kind of helped myself with the advice you were giving me and, made myself into a better person. In general, you just kind of made my family a family again. Instead of us yelling at each other, now we try to find a solution to our problems and try to kind of make a place where we can all have what we want. The whole family kind of just reunited in a sense, and we all kind of came back together, and with that we kind of build our trust on each other again, and we kind of just gradually became mom and son again.
Many women who are affected by alcohol and drug use and also have mental health problems have experiences of violence and trauma. Seeking Safety provides women with alternative coping skills and strategies to stay safe without resorting to substance use or other unsafe ways of coping. With our local partners, we provide women with skills to make safer choices, stay in treatment, handle trauma symptoms, and reduce relapse.
I was physically abused, emotionally abused. I think the emotional abuse was far worse than anything else because you feel that you really can't do anything. I was alone and desperate, afraid every day. I didn't want to talk to my family members about the things that were going on because it looked very perfect from the outside. My darkest night of the soul, I believed, was when I really knew the only way out was to just kill myself. So I knew that I was really, hopeless. And how do you reach out and tell someone those things? Seeking Safety, it was an organization, a class that we used as a tool to speak with other women that had these unspeakable, strange manifestations of abuse and of self-abuse. It didn't look so hopeless when we were with a group of people that were bringing a little light into the subject. I had tremendous community support, and it was a way home to myself that I never imagined that I would find. These people that brought me to a place of love, self-love, the ability to identify love, that's a gift.
These are just a few of IHR's programs that have changed many lives. We dedicate our work to the courageous individuals and families we serve. At IHR, we believe in the power of recovery. For more information, please contact us.